Hi, my name is Karen Trombley. This is my video on the National League of Nursing's 8 Nurse Educator Core Competencies. For Competency 1, Facilitate Learning, I co-teach a pre-op joint replacement class with a physical therapist. We use a PowerPoint presentation and have written material to give to the patients to help students of all different learning styles. For Competency 2, Facilitate Learning, Development, and Socialization, I preset final semester Herzing University nursing students for their final clinical rotation. I look for opportunities to provide the students a chance to use the nursing process to the fullest while they're caring for 2 to 5 patients. For Competency 3, use assessment and evaluations strategies. While working with these final semester nursing students, at the end of each shift we have a short discussion on things that we thought went well and things that could be improved upon. We also do a midterm and final semester course evaluation. I evaluate the student and the student also does the self-evaluation. Then we look at each other's evaluations and have a discussion about those evaluations. For Competency 4, participate in curriculum design and evaluation of program outcomes. Last semester, I had the opportunity to design an online course for Gateway Technical College. It was called Electronic Health Records. As part of that project, I also made an assignment with a rubric for evaluation. The rubric provided me guidance in evaluating the student's performance on the assignment. For Competency 5, function as a change agent and leader. Last semester and this upcoming fall semester, I took a position as a tutor for second semester nursing students in a health alterations course. I feel that this is helping me as a change agent because in my role as a tutor, I am not teaching them. It is my job to help guide them look at how they study and are there ways they could more effectively study. I feel that this could help me in the nurse educator role to help remind me to remain student-centered and look for active learning strategies to use within my classroom. So that's how I'm hoping to be a change agent as a nurse educator in the future by using tools that I am learning now as a tutor. For Competency 6, pursue continuous quality improvement in the nurse educator role. At my current job, I am on a research committee, and we are looking at 2 different fall assessment tools to help determine which tool will best guide nurses to choose the most pertinent interventions to help prevent patient falls. As a nurse educator in the future, my plan is to continue to have lifelong learning. I want to look through research, go to classes, things that are keeping me most up to date on the best way to be a nurse educator. For Competency 7, engage in scholarship. I currently utilize discovery through the research project that I'm involved in. I utilize integration through team meetings. When we have patients who are with us for more than 2 days, we put together a collaborative meeting that involves the patient, their families, the nurses, physical therapy, occupational therapy, the doctors, and social work. We look at what the patient goals are and ways to best meet those outcomes so the patients can have the best outcome and reach discharge. For application, my position as a tutor for Gateway Technical College helps me with that part of scholarship. And I utilize teaching through my co-teaching of the pre-op joint replacement class. For Competency 8, function within the educational environment. When I began my practicums at Gateway Technical College, I had the opportunity to meet with the Dean of Nursing. And she allowed for a conversation on what Gateway stands for, where the role of AD in nursing is moving toward in the future, especially with the IOM report of wanting nurses to be 80% BSN. And through our conversations, we had a great chance to look at some of those different things and where the future is leading. So overall, I want to thank you for watching my video on the 8 NLL Nurse Educator Core Competencies, and I look forward to the future.